In terms of that, last an increase in of 2 a trend across the continent. For an increase in Central Africa, decrease in West Africa. As a continent, we have the past 4 weeks, 51 million and Rwanda. So just in terms of what Africa's CDC is doing across the continent, we on June 17 trained over 700 healthcare workers in 40 member states in infection prevention measures. And just yesterday, we published new guidelines on IPC, which is Infection Prevention Control for Primary Healthcare. And we continue to make progress across the continent in terms of training vaccinators, a very good uptake. So again, these numbers, they speak to the fact that if vaccines are available, people are willing to use it on the continent. Vaccines must be available in a predictable manner so that countries can arrange themselves, organize, work with partners to ensure that they are used immediately. The total coverage, however, remains at 1.12% of the population that have been fully immunized. Fully immunized meaning that they are receiving the 2 doses. And this represents a slight increase of about 40% compared to last week. If you recall, last week we were around 0.78%, and this week we are around 1.12%. Again, my interpretation of this is that there's so much talk about vaccine hesitancy on the continent. It's in function of predictability of vaccines. If the vaccines are available, people will step up and use the vaccines. A few countries are still have still not received the vaccines: Tanzania, Sahrawi Republic, Eritrea, and Burundi. On June the 7th, the Health Ministry of Egypt said they were starting production of locally in Egypt of the Sinovac vaccine, after signing an agreement with China to produce locally and distribute the vaccines in Egypt and other parts of Africa. The first virus meeting about 5 was that I was receiving the Honorable Ambassador from Egypt, who was just explaining that initiative to me and urging that we put that into a continental. I do pay a visit to Egypt to look at what is going on with that vaccine manufacturing, which I happily accept is going on there. On June 7, according to the announcement, they had COVID. An agreement with the Belgian biotech group, I think very promising. 2022, Senegal will begin to produce that. Again, couple that with that. On June the 22nd, the World Health Organization, as you recall, manufacturing hub in South Africa, and that is also going to be a boost to our vaccine manufacturing efforts across the continent. On June the 16th, CureVac announced results of a trial from their product, which, so when that is the situation of COVID, and I'll return it over to you.
Thank you very much. with that briefing, that bag of good news and some. Now is the time for you to put forward your questions so that you can get the specifics of today, and call in Gabrielle Steinhauser. Gabrielle, I believe
in June, just when infections there were rising dramatically. And I'm just wondering if you're seeing other changes in the sequencing data you're getting from member states where you're seeing similar increases of the Delta variant, and how concerned you are as you receive more data about what this variant could do in African countries where so few people are vaccinated and so few people are fully vaccinated.
That's an excellent question. We are seeing that the variant really aggressively taking over from other variants, not just in Uganda, but in other countries like the DRC. I was just analyzing the data a few minutes ago, and it's remarkable that within 6 weeks, that variant in DRC became a very, very predominant variant. And with that analysis is going on, what the situation is. As we speak, Africa CDC is hosting an important workshop in Nigeria, where we've brought together so many experts across the continent to work on and analyze and continue to generate data on the variants across the continent. One thing I omitted to mention is clearly that we are in the middle of a third wave. At least 20 countries are now full across the continent, and it is a very devastating. One thing we see is that the peak of the third wave is remarkably high. Speaks to the fact that there are several factors contributing, and maybe, and just maybe, the variant in question is the Delta variant is perhaps playing a very significant and share that with you.
Thank you very much. Let me take a question that's coming in from Kara Anna from the Associated Press. And Kara says, thank you for the briefing. What are your concerns as the virus spreads further into rural areas that are relatively unequipped to respond to it?
Kara, that has always been our greatest fear, that if we do not do something and do it quickly, then the virus begins to spread. Difficult to do mopping up operations, and that will become the beginning of endemicity of the pandemic. And we shift from a pandemic to just begin to think of how do we manage this in terms of an endemic disease, just as we do with malaria, TB, and it was to do rapid scale-up vaccination, which unfortunately the numbers speak for themselves. We are at around 1.1% coverage there, which is far removed from a target that we were expecting to be at this point. So very unfortunately, we are seeing that. The good news, however, is that based on analysis, looked at the Zambia data very carefully yesterday with the leadership of the Ministry of Health of Zambia, and a lot of the new cases are occurring in Lusaka. So that means that if we implement public health measures and scale up vaccination in major cities, we can actually blunt the spread of those viruses into the remote areas. Lusaka is really the turning point where they actually move orchestrate transmissions to those remote areas of the country. So again, the key is vaccination. We will not stop the virus from spreading to remote areas.
Thank you very much. Diallo, please give us the news agency that you're calling from and then ask your question. Dr. Diallo, can you hear us? Your microphone is muted. Please unmute your mic, Dr. Diallo. All right, let's move on and take someone else who's joining us online, and that is Sophie Mukwena from the SABC. Good morning, Sophie.
Good morning. I just want to find out from Dr. Nkengasong, South Africa is experiencing surging numbers, particularly the province of Gauteng. Yesterday, the stats were really, really shocking. What could be the reason? Is South Africa battling a challenge of the Delta variant, or is it still the variant that we know that was detected in South Africa? Secondly, the slow pace in terms of access to vaccine or vaccinating the population in South Africa, with the level of numbers or the level of aggressiveness of this virus in South Africa. Are you not worried? What are the health officials saying? What's the problem? I mean, even to access vaccines, the COVID facility, we haven't received any consignment from COVAX while we had procured vaccines through this facility. South Africa is in a crisis.
So thank you, Sophie. Let me say that. Let me start with the last question and work backward. The situation of access to vaccines on the continent as a whole is, to me, a moral challenge, a moral dilemma for all of us. We have heard pledges across the world, but we all know that unless and until we see those pledges transform into vaccines, put into people's arms, that doesn't solve the problem for the continent. The continent is lagging behind. There's no other way of putting it other than the fact that we are completely lagging behind. We just don't have vaccines enough for the continent. Is that we just simply don't have vaccines, period, for the continent. As I indicated earlier, has been fully immunized, and this is a continent of 1.2 billion people. So that is the situation in South Africa is not different from what we are experiencing across the world. It's the same issue we have all discussed over and over, that certain countries bought all these vaccines. COVAX had the money but they didn't know where to go get the vaccines, and I think we are all in that situation. The next couple of weeks in August, through the AVAC mechanism, the African Vaccine, President Ramaphosa, when he was the chair of the African Union, will begin to release doses of vaccines through a contract that we have signed with them, which I've explained severally on this. So hope is on its way. Let's wait, give it in the next few weeks. Beginning of August is not far. We are already in discussions with countries, sending them note verbals to explain that they should be ready to receive their first doses of the vaccines, Johnson & Johnson from the AVAC. So that is, unfortunately, the situation on the continent. In terms of why the situation is what it is, Africa, I would also believe that the situation that the winter situation in Southern Africa is a factor, because of when it's cold, people tend to be indoors a lot, and we know that it's a lot. On that note, Sophie, I would like to say that I'm encouraging all countries to pivot their message to that. You don't just wear masks in public, but indoors you should still be extremely careful. A lot of transmission occurs in households, where people come from outside with the virus inside, and then they believe that they feel the warmness of home, they are comfortably in homes, and they do not exercise those same measures that are required out there. So I think I really urge that countries lay emphasis, especially in the midst of this third wave, to actually prevention measures that are indoors oriented. Avoid gatherings indoors. That offers a lot of space for the virus to transmit. And I think with that, we will be able to bring it down, bend it down, the curve down again. with new variants, I don't know. Look at the genomic situation of the variants in South Africa the last couple of weeks. Colleagues, Professor Tulio, to see what their database is telling them. We work very, very closely with them, and I think in the next coming days or so, we should be able to know whether the Delta variant is behind what we are seeing in South Africa or.
Thank you very much, John. We say good morning to Paul Adepoju. And Paul says, what is your assessment of the third wave across Africa? Which countries are worst hit? And how prepared are member states? And what is the contribution of the Delta wave to the third wave on the continent?
Several countries have been hard hit, Paul. As I indicated, about 20 of this terrible third wave. And what is unique and common across the board is that the peak of this third wave is remarkably higher than the second wave. So it's more severe than the a healthcare system being overwhelmed. And this is the first time the health system, the hospitals are completely overwhelmed. Yesterday, as I indicated, we had a very long call, a technical call with the leadership of the Ministry of Health of Zambia just on that. And we will be dispatching a team of experts to Zambia in the coming days. We also respond commodities to support that way because they are completely overwhelmed. You look at DRC, I'm sure you heard the president of that country just last week making in a press. Uganda, you've seen how overwhelmed the systems are there. So this third wave has come in with the severity that most countries were not prepared for. And look at the data yesterday, it only took them 3 weeks to 4 weeks to be overwhelmed. So this is a virus that sits itself and very quickly takes over your hope that countries will take for the third wave. And here we are with that situation. So I think I'm calling on everyone, including all of us on this platform, to really help to expand that message, share that strategy, which we have it on our website, so that countries can actually implement it. I will today, in the next couple of minutes, at the top of the hour, be briefing a bureau of the head of states meeting on the situation of COVID and asking them to really make sure that we take that strategy at heart and implement it, because it's frightening to see what is going on across the continent. There's no better way of putting it other than saying it the way it is.
Now let's go on to Edith Mutetia, and Edith is with China Daily. And she says, among the reasons why some people are hesitant to take COVID-19 vaccines is the fear that mRNA-based COVID-19 vaccines could be having unknown side effects that will manifest months or years later. What is your take on this?
My take on this is that I fully understand and respect people's concern when it comes to new technology. But I say that as an immunologist, virologist for close to 30 decades, that technology will not impact your DNA, because that is where the fear is. That the mRNA that is mentioned doesn't even get into what you call the core, the nucleus of your cells, where your genetic material is there, and it completely has no impact. In other words, if we were dealing with a scenario where the messenger RNA will go into the core and integrate into your genetic material, then you'll be having an issue there. That is not the case with this technology. So I think I'm less concerned. Will I take it if I have the chance of taking either the Moderna or the Pfizer vaccine? Absolutely yes, without thinking.
All right, time to say hello to Judith Akolo, who is with the Kenya Broadcasting Corporation. And Judith says, would we be correct to say that Kenya is in a fourth wave? And her second question is the Delta variant responsive to the vaccines being administered on the continent?
Let me start with the last question. Yes, we are still analyzing data to see and find out how these vaccines are protecting against the different variants. As we speak, Judith, we have a team in Seychelles, and the team has been there for close to, this is the second week, actually, that we dispatched a team there to work with the government of Seychelles to begin to investigate some of the vaccines that they are using and their effectiveness. And the reason that we choose Seychelles is that their coverage is very high. We have immunized over 70% of the population. And just a few weeks ago, if you recall, they were dealing with an upsurge in number of cases. So we dispatched a team to work with the ministry to find out what is going on and in-depth analysis of what is going on so that we have evidence to back up any claim. For now, I don't have any data yet to speak to the effectiveness of the vaccines vis-a-vis the new variant. Is Kenya going through the fourth wave? I think the data that I have in front of me, it would suggest that it is still the third wave. A projection. I think that is an analysis that we're just doing yesterday. But again, we still need to look at in depth to see if that is they're at the tail end of the third wave or they're in the beginning the fourth wave.
All right, thank you. Good morning to McDonald Zirutwe, who is with Reuters News. So McDonald says, could Dr. Nkenga Song comment on the plans to overhaul the COVAX program? In particular, what are the implications for countries like South Africa, Botswana, and Namibia, who will have to pay for vaccines in advance as they are considered middle-income nations?
I think the issue we have in front of us now is timely access to vaccines. Let me just repeat what I've said before, not necessarily on this platform today, is that we have to vaccinate at scale and at speed. Whether you get your vaccines from COVAX or you get it from AVAC, you get it from bilateral, we have to do that quickly. We are running a race behind time here because the pandemic is ahead of us. Let me put it very bluntly. We are not winning in Africa. We are not winning in Africa, this battle against the virus. So it really doesn't. If you look at the graphs of the brutality of this third wave, in Namibia and all those countries that you mentioned, is extremely frightening to see how quickly, within just 4 weeks, the virus have taken over.
Move on to somebody else and come back if we have enough time. So the first question from Vijay is, what is the current status of progress in Tanzania with respect to the new task force's evaluation of the situation? If the results are not out, the Tanzanian government have
that's a message that is making progress in the right direction in terms of opening up and acknowledging the pandemic. That is a very good positive step. The second thing is that what their needs are. And of course, the news that they are engaged with COVAX is very encouraging with them to see how they can. You heard last week or this week, the AU and the AVAC team with respect to the partnership with to support countries to acquire their doses from the AVAC platform. Doses that we will be part of that. So again, encouraging signs in Tanzania. A lot still needs to be done, and we continue to engage them to offer our support for in a whole variety of funds.
Times of Swaziland. I'll give the first one and try to list. So the first question, has the last mile program supported by Coca-Cola been in developing countries?
Yeah, I've not, I don't know how, I cannot comment on that.
All right. We move on to Agostino Leite, who is with LUSA. With a seemingly fourth wave, Dr. Nkenga's song see its impact on the flow of vaccines to Africa?
It would, of course, have. We saw what happened in India once people or a country by the virus. The tendency is to the exportation of vaccines and other. Not be surprised that impacts severely ability for countries to redistribute vaccines and the ability to export the vaccines that.
All right, let me come back as a freelance journalist representing the Lancet. So he says COVID-19 case number. So he goes on to is called Weekly Operational Report, and that Democratic Republic of Congo, Namibia, and number of new weekly cases. Could you share to the surge?
No, so it's not just those countries that are going through a serious surge in number of in the middle of the third wave, also part of that. So it's one strategy and holistic. There are three things you need to remember. The P, monitoring and enhanced treatment, and advising and prevention. We are looking at two main things. One is we must, I use the word must deliberately, gatherings, okay, whether they are religious gatherings, political gatherings, we have a direct opportunity for the virus to transmit, and it's better than the previous variants. Second is the vaccine. Without vaccines, we cannot blunt the level that we can declare victory. The vaccines will be underneath the M. The monitoring is enhanced. We need to take advantage of the existing antigen test and do the hotspots and then do something with them. Either monitoring is the ability for us to actually monitor the variant, as we have discussed it in the situation in Uganda and in DRC and several other countries. A lot to be able to either move specimens for those countries that do not yet have this fighting this pandemic. We just didn't know. So we need to adapt as a comprehensive. Last part is the treatment. Oxygen must be available. So many people are dying because in same oxygen. Again, the first argument, it was really sympathetic in that country with respect to shortage of oxygen. So where they've run out of capacity completely. So I think it is those are we are supporting them to do, and that's with countries to deliver on those three components of the adapted strategy.
Thank you. Daily in South Africa.
Earlier that we have a team as we speak in Seychelles, and just let us have a chance to, and I'm sure by we would have analyzed evidence-based state complete the task ahead of them.
All right, so let's move on to our last question, and we go back to Bonisile Makubu. She says, is there a change in the manner of variants when compared?
Yeah, unfortunately, we are seeing or reported cases younger population. It just started, so it is very and see and have real evidence that that show clear association between the new variants and the infection of, and as they mutate, consequences in terms of among. We still have a lot to learn from this virus, that we celebrate what there's a lot that we still need to learn, and humble ourselves that we have to work collaboratively to understand what is new variants. But we have at speed and at scale.
John, we have about, so it's time for us for today.
Support spirit to scale up that I presented today. That speaks to the fact that if there this press conference remember in mind that have been used doses. The vaccines are available. Message to dispel. If vaccines are available, many people for Africa. It is all over the world, and we in public health, civil society, to make sure that we use the vaccines. And so, in other words, if the population of, say, it will say they will not use the vaccine, it doesn't mean that's Cote d'Ivoire was extremely low, but with an engagement with the civil society very quickly and in a short. Here to work with the media to engage across the continent. If
very much Africa CDC. heads of and action, and for the continued, given the status. Colleagues, journalists and communicators, I thank you very much for being. Happy week coming ahead, and let's meet again next week, Thursday.